Hey guys, just wanted to thank you for watching my presentation here on YouTube. We've been talking a lot about health and megaregions. Last week we heard some great presentations about asthma, as well as the origins of some public health concerns. And then we also had a really informative talk from Carol Haywood from the city of Austin about some of the health efforts that the city is going through right now. So I just wanted to delve a little deeper into the topic of obesity. I know we touched on it a little bit, but wanted to look at how that relates to the built environment, and then also how this topic relates to the readings we had this week. So someone raised the question last week about how exactly do we define obesity, and the definition that is most widely used is a BMI of 30 or higher, body mass index, which is basically kilograms divided by a person's height squared. And I know there's been a lot of controversy over this definition. Some people think it relies too much on a formula, and that may or may not be true, but regardless, that's kind of what is used universally at this point. So we've seen some of these statistics already, but I just wanted to touch on them again to show just how big of an epidemic this problem has become in the country. So these stats are from the CDC. We know that 1/3 of adults are obese in this country. Medical costs are obviously a huge factor. And then there's also a racial and ethnic standpoint to it, which needs to be looked at a little closer too. So I know Carol Haywood kind of stole my thunder on these slides, but I think they're worth looking at again. I think we both got our stats from the CDC website, which is a great resource, but I wanted to go through these again really quickly just to illustrate how seriously the obesity epidemic has become. And while we go through them, I'm going to go through a little fast, but pay attention to the regional concentration of the obesity rates and kind of think about what that has to do with megaregional planning. So here we go. We can see new categories being added. Another category. Starting to concentrate a little bit in the southeast. And then by 2007, we got 2008, 2009, 2010, we can really see the concentration regionally in the southeast. And we talked about that last week too. But, I was just thinking about how we've been talking a lot about different ways to define megaregions. And, it looks like, unfortunately, that obesity might be one of those variables, along with the environment or transportation connection. So I thought that was kind of interesting. But anyways, I wanted to point out this article that I found called The Obesity Relationships with Community Design, Physical Activity, and Time Spent in Cars. And this is kind of a highly cited article from the American Journal of Preventative Health. One of the authors is Lawrence Frank from the University of British Columbia, who's fairly well known in planning circles on his work with the relationship between land use and transportation and public health. So really they wanted to evaluate the relationship between obesity and the built environment and transportation activity patterns empirically, while also looking at the effects of ethnicity and gender. And so I think the two keywords there are empirically and also looking at the ethnic and gender components to these relationships. So the methodology they used was looking at travel surveys of around 11,000 participants in the Atlanta region. So there was 13 counties. These participants basically reported their origins and destinations and their mode of travel over a 2-day period. That's pretty standard for transportation diaries, things like that. And they also looked at sociodemographic information, such as household income and household size. So the methodology they employed was kind of cross-sectional travel survey data, and then comparing that to objective measures of land use mix. So they also wanted to look at gender and ethnicity, like I said, because a lot of previous research has found significant differences in obesity rates across gender and ethnicity, and especially with Black females who have had higher obesity rates than other cohorts. So that was kind of an important thing for them to look at. So basically what they wanted to do was come up with a regression model that could predict the likelihood of somebody being obese based on where they lived, what the built environment looked like around where they lived. So this travel diary really presented a good opportunity for that. So the dependent variable they used was body mass index, which was derived from their height, weight, which were reported from the travel survey. For the independent variables, they looked at sociodemographics, age, education, household income. Those were also from the travel survey. Physical activity was from the travel diaries. Basically, they measured that as time spent in the car and distance walked. And then also they had 3 measures of the built environment. And so we have connectivity, which is the number of intersections with more than 3 legs per square kilometer, residential density, which is the persons per residential acre, and land use mix, which is kind of a continuum of basically 0 is single land use, 1 is perfect mix between all 4. So I'll explain how they came up with those a little better. They basically used GIS, geographic information systems, to look at these objective measures using county tax data, regional land use data, the Atlanta street network, and then census data too. So basically what this is showing is that on the left we have a disconnected area. And so they basically, instead of using a 1 kilometer buffer around the person's household, they did a 1 kilometer network buffer. And so on the left there, you can see that if you stay on the network for 1 kilometer, you can't really get too many places in this disconnected network. It's a little harder to see on the connected network on the right, but there's a much bigger area. And that's basically just to show how they came up with connectivity. And then they also used GIS to come up with the net residential density number, which is the number of persons per residential acre, and then also land use mix, which I talked about, that continuum from 0 to 1. So basically, after looking at these relationships, they found that land use mix, car time, and distance walked were significantly associated with obesity. And this is from the regression model, again, that shows the estimation of how likely it is that you would be obese if you lived in one of these areas. So you'll notice that connectivity and residential density were found to be insignificant. They weren't in the final model, basically. And basically that was kind of a statistical thing. They found that there is high spatial collinearity between those and land use mix. So just based on the statistics of it, they left land use mix in and not the other 2. Some interesting sample characteristics that they found were that the mean body mass index of all those cohorts was highest among blacks. And 33% of the whole sample was considered overweight. 17% was considered obese, which is more or less in line with what we saw from the CDC. It's a little less, but this study was also done in 2004. So as we saw in those slides, a lot has changed since then. So that should be expected. Just to look a little closer at this regression model. So this is looking at land use mix. Basically what they found was that moving up 1 quartile along that 0 to 1 continuum resulted in a 12.2% reduction in your odds of being obese. So basically, if you break up that x-axis into 4 different quartiles, moving up a different one would lead to 12% reduction in odds of being obese. One interesting thing they found was that their study area, Atlanta, had a land use mix of 0.15, so very, very low on that mix scale right there. And I think that should be expected from what we know about Atlanta. It's it's pretty sprawling, kind of auto dependent. So that was a big factor in their findings. So here we're looking at the results of the walking distance regression aspect. So here they were looking at walk distance per day in kilometers, and they found that each kilometer walked per day resulted in a 4.8% reduction in the odds of being obese. So pretty significant there. They also found that average walk distance was greater for blacks than for whites. Moving on to minutes spent in car, the authors found that based on the regression model, each additional 60 minutes per day spent in the car resulted in a 6% increase in the odds of being obese. So minutes spent in car was higher for whites than blacks, which was opposite of what we saw in walking distance. Another statistic that they found that was really telling of Atlanta was that 30% of the sample spent more than 90 minutes per day in the car. And that's pretty long. I think a lot of us probably don't spend that much time in a car in a week. So again, that was really telling of the urban form of Atlanta. So I wanted to relate this article back to the readings from this week, and I wanted to kind of find one sentence that wrapped this all up and kind of tied them together. And this is what I came up with, is that the common theme was that we're finding empirical evidence about the relationship between public health outcomes and land use and transportation, and how to communicate that evidence to enact policies that promote active living. So I think we saw a lot of really good resources that hopefully we can all use in research going forward that kind of talk about this empirical evidence, these correlations between public health and land use and transportation, and then also how we can use that evidence to bring about policy change to promote active living. So one article that I really appreciated this week was the Public Health Roots of Zoning article. And us planners, we have to take a planning law course for our core course our first year, and so a lot of that was a lot of repeat material, but it was really good to go back and revisit. And there were some new things too. One thing I really took away from it was that the authors argued that zoning and other land use regulations, and really a lot of planning issues in general, kind of get framed as a discussion of private property rights, when really, if we look back at the history of it, it's really rooted in public health. And the authors make the point, and I really agree with this, is that if we can make that tie back to the public health roots of zoning, we'll have a lot easier time communicating things to the public and enacting policies that promote active living. We've talked about obesity and air quality, and really, in all of those things, we've seen a clear correlation between the built environment, transportation, public health, and really it's just a matter of communicating that, communicating to people that planners aren't there to socially engineer, that there really are things we can do to give people more options to live healthier lifestyles. And one thing I was thinking about, a parallel to all this, is the climate change debate. We have pretty clear empirical evidence on some of the trends that are happening in terms of climate change. And I mean, there's obviously things that can be debated in terms of how big the problem is or what it means, but we have some evidence. But still, it's proven to be a big challenge to communicate that to a substantial portion of the population. And I think that's a big challenge, and it's a big challenge that planners face, and really everyone in public service faces, is how do we communicate this empirical evidence, and how do we have it lead to change? So 2 discussion questions related to that I wanted to raise this week were, first, what role can or should megaregion scale planning play in improving public health outcomes? Or are these problems just very local problems? We've talked a lot about what policy areas megaregional planning has, what role it serves best in. Personally, I think that in terms of public health, megaregional planning probably has the most to say about transportation and improving air quality, but I'm certainly willing to hear other arguments about that topic. Second question I wanted to raise was, what is the most pragmatic way to bring about policy change that promotes active living? Will it be bottom up, or are litigation and top down policies the most likely impetus for change? And what really got me thinking about that was, again, some of the air quality climate issues that we've seen. We've seen a lot of progress made in the last couple of years by the EPA, using litigation to kind of reduce carbon emissions from power plants. And that the strategy they used was litigation, kind of top down, and that's been very effective. So I'm wondering if that's how we're going to see tighter land use regulations to promote active living, or if it's going to be a bottom up type thing where we can again convince the public that maybe some of these innovative different land use regulations, form-based codes, things like that might be good for everyone's interest, and maybe there's really a responsibility to change the way our built environment looks to address some of these things such as obesity that become epidemics. So I'll leave you with those questions. I'd be happy to discuss them with anybody. I know YouTube isn't the most conducive medium for in-depth discussion, but anyways, I really appreciate you watching my video. Thanks a lot.